working through things like the pain, correcting the latch, having your baby open their mouth bigger, get more of your breast tissue, so not just the nipple, but like that kind of brown area around it, the areola, into their mouth so that they can compress that. That doesn't hurt, as opposed to compressing the nipple. And that helps them get more milk out. Babies are happier, they're satisfied, they suck longer, and it doesn't hurt mom. But if you have a baby with a shallow latch, it not only hurts in that instant when they're latching, but it damages the nipple. It bruises it, and ultimately those bruises on that very fragile tissue that's around your nipple get cracked, they start bleeding, it becomes intensely painful. Cracked and bleeding nipples are not a reason to not be able to breastfeed. You could change the latch, and if that changes the pain as the nipple heals, you're gonna start feeling better and it'll be easier. The slight amount of blood that's in your breast milk is not going to hurt your baby. So cracked and bleeding nipples is pretty common. A lot of physicians worry about infections in the nipple, and I gotta say, this happens sometimes, but it's not the most common cause of nipple or breast pain. So mastitis absolutely happens, but in terms of infection directly on the nipple, I've heard a lot of people worry about yeast. That's not terribly common. Yeast lives on our skin certainly, but yeast infections on the nipple are not the most common thing that you see. If you actually think that her nipple, after being cracked and bleeding, is now infected, it's more likely a bacteria, which is the same for any other spot on our body. If you get a cut somewhere else on your body, it gets infected, your first thought is bacteria. The same should exist for an infection on the nipple. So treating it with an antibacterial is probably the most effective therapy. Most of those antibacterials are very safe for breastfeeding moms. You have them put it on after they feed their baby because you don't want the baby trying to latch onto a nipple that has ointment on it. But the ointment absorbs prior to the next breastfeed, and so it's completely safe. She doesn't have to wash it to clean off any of the antibacterials. If you want to put her on systemic antibiotics, if you are worried that this is turning into a systemic infection, that is certainly still considered safe in those mothers. And having someone help mom evaluate during a feeding, watching how the baby is positioned close to mom. Baby and mom need to be abdomen to abdomen, so baby can't be positioned far away from her. The mouth needs to be positioned at the nipple, kind of almost with the nose pointing at the nipple, and then open really wide so that a large amount of the breast tissue actually gets into the baby's mouth. And so having someone in your office, either yourself or someone else who's trained in evaluating a breastfeeding mom and in helping with these basic latching skills can be very beneficial to your breastfeeding mom, and taking the time to actually watch a feed in your office and see what the problem is, because sometimes it's a very quick fix and it can change the course of her breastfeeding success.